We now head to South Africa, where the Minister of Health, Joe Pala, said the unprotected strike by the National Education, Health and Allied Workers Union, Nehawu, that intensified across the country has led to the loss of lives. Gauteng Department of Health says there was a complete shutdown of operations when striking workers went inside hospital wards to order working staff to stop their duties on Wednesday. Emergency medical services in the province had also been threatened and have been unable to respond to all emergency calls. Staff have also been denied access to the facilities. As a result, the Provincial Health Department obtained an interim interdict overnight, preventing the disruption of medical services in Gauteng. We'll now take you to Senegal, where rising tensions, that is, characterize the atmosphere a year ahead of the presidential election. Several activists and members of the opposition are denouncing a retreat from democracy. I'll tell you more about that story. My understanding is that we would have to go back to our earlier story on South Africa and talk about Nehawu's strike action. Joining me now on the news to discuss this issue is the spokesperson for the National Health Department, Foster Mohale. Good afternoon to you, Foster. Many thanks for joining us here. It seems the ongoing Nehawu protest is intensifying and public health properties being vandalized. Workers are being stopped from attending to patients. What are you doing as a department to stop this?
Good evening, and good evening to your listeners and of your TV stations, and thanks for this opportunity afforded to the National Department of Health in South Africa, as already indicated. Yes, it was very sad in the history of the country, where you see the hospital literally shutting down precisely because the striking officials, they blocked the patients from entering, they blocked the staff, the nurses and the doctors, and the family members wanted to visit their loved ones precisely because they're not happy with the current salary negotiations between the unions and the government. So yes, the situation was very bad for the past 2 days, where you see the doctors being unable to save the lives of our people. Yes, as you indicated, that there are some preliminary reports which suggest that about 4 people have lost their lives precisely because of the impact of this strike. Obviously, when the doctors and the nurses are prevented to enter the hospital, the wards, to see the patients, what do we expect? Some of the patients could not even get food precisely because of the disruptive and violent actions by members of a trade union called Nehawu.
Very well. So what will the department do to ensure that this does not go beyond what we have seen already?
No, definitely the Minister of Health has been in contact and in consultation with the Minister of Police in the country in order to seek the more police presence at these affected hospitals and the clinics in the country, in order to ensure that the police, they enforce law and order, to ensure that those who want to come into the hospital to save the lives, they must do that without being intimidated or threatened by any people. That's why today we can safely report that the situation is much better as compared to the past 2 days. We have seen hospitals able to open, even though it was not the staff presence was not 100%, but you could see that it's more than 50% in some of the hospitals. Of course, we still experience some pockets of violence in some other areas around the country. But also what we have done is that we've applied for court interdict preventing any striking officials from barricading, closing the entrances of the hospitals, striking or protesting around the premises of the hospitals. So that those court interdicts, they empowers the police to deal with anybody who violates that court interdict by protesting closer to the hospitals.
And you got this interdict overnight. How would you say that it's working favorably?
In fact, what the court interdict that you're talking about. Remember, in South Africa, we've got 9 provinces. I don't know how in Nigeria it's organized. We've got 9 provinces. So these 9 provinces have got the MECs of health who are working closely with the National Minister of Health. So we have advised all the provincial MECs responsible for health to apply for court orders or court interdicts. So far, we've got about, out of 9 provinces, about 6 of them have successfully been granted with the court interdicts in order to empower the police from dealing with those who want to continue with the disruption. So about 6 provinces have successfully applied for court interdicts. So we're still working closely with other provinces. The good thing is that the provinces which have not applied, they did not experience a serious disruptions as far as the provision of health services is concerned.
Very well. How are you also working to meet the demands of Nehawu?
Remember, in government, the way the government is structured is like we've got the Department of Health, which is responsible for providing the health services to all South Africans. We've got another department which is responsible for negotiating the salary and wages for all public service workers. So there's a relevant department which is assigned for negotiating on behalf of government closely with the union. So the Department of Health is not involved just like other departments. So we're trying by all means to keep our lane by providing health services to all South Africans. Those who are responsible for negotiating the salaries, they continue to do that, just like all other departments, like the police. They are not involved. So we allow the process to unfold without any influence, because it is not the responsibility of the Department of Health. And also the salary negotiation process does not only affect the health workers, but all public officials in the country. Yes.
We'll leave it here for now. Thank you so much, Foster.
Thanks very much for this opportunity.